ask you a question
Yeah.
about that because somebody wanted to know if somebody is positive but they don't need to be hospitalized and you send them back home, um, how do they keep their caregivers or their family members safe?
Yeah, it's a great question. So I know that some folks have taken to, for that very purpose, to protect their family members from not contracting the virus at all, is they will quarantine themselves in a manner that minimizes the exposure that they would have to any family members. That I've heard where folks will literally quarantine them to a specific room in the house, in a bedroom or something, and they don't leave that room for that 14-day period. So the rest of the family, lives out in the rest of the home. There are some families that will go live someplace else with a family member or a friend, and so that the house is left just to the positive COVID patient.
So watching the news is really scary right now, and they keep referencing a surge. There's a surge coming. So what is Kauai Delta doing to prepare for a possible surge of patients?
Yeah. I have to confess, I probably watch way too much of the news myself too, and I'm trying to discipline myself not to, because it is scary.
It is.
There's no doubt about it, and healthcare workers, they're putting themselves on the front line. They probably have the greatest risk of exposure, so they're just as scared here. So far, I think Tulare County has done an outstanding job implementing and adhering to the social distancing recommendations. And I think in a county of 500,000 people, to only have had 18 positive tests and only one of them having to actually be admitted is a very, very good thing. And so I applaud our community for taking it very seriously. It's interesting that the hospital, in some respects, feels a bit like a ghost town right now. As I go up on the units, every day I'm out there rounding, I'm going into the emergency department, I'm going into the tents and talking to staff. I was on the ICU this morning and 3 North, and so I went into surgery and the recovery, and so just out talking to folks, and it's very, very quiet. The flu has, amazingly, this is one takeaway that we should have, is that this self-distancing, the social distancing and the constant washing of your hands, the flu has all but disappeared in Tulare County. It literally has hit rock bottom. And so that's had a positive impact on the emergency department and the inpatient hospital, as we just have a lot less respiratory problems. We also have purposely really cut back on elective surgical cases. So I've been working closely with our anesthesiologists, our Department of Surgery, who are carefully looking at each and every inpatient or outpatient elective surgery, determining, is this something that could be postponed without causing, any risk to the patient. And it always is a decision of the physician and the patient. So the hospital doesn't get involved in those decisions. But we've had about a 30 to 40% decline in surgical volume. And ideally, there's really 3 objectives that are trying to be achieved here. Number 1, to limit the amount of exposure. So not, unnecessarily expose a patient that doesn't have to come into the hospital, doesn't have to have surgery and go into the operating room. That's first and foremost our number 1 objective. The second is the preservation of personal protective equipment. So masks, gowns, gloves, shields, things of that nature. If you can postpone surgeries, that's just more PPE, which is the acronym for it, that's just more of that can be preserved. And then the third is to keep inpatient beds open in the event of a surge. So right now, we have many, many inpatient beds that are open. Most of the emergency department exam rooms are open. Earlier this month, the federal government eased restrictions on the types of patients that could be admitted into our acute rehab hospital. So that's a 45-bed hospital on our west campus. Generally, you had to meet very restrictive types of conditions before you could go in. That's now completely waived, and all 45 beds are available for any kind of admission. We are looking at alternative care sites. Last week, Randy Groom and I had a discussion about, in the event we really were to experience an intense surge, could we take over all or part of the Visalia Convention Center as a possible site. The governor actually appropriated $1 billion with a B to lease or purchase motels, hotels, to open up shuttered hospitals that have been closed down, to quickly retrofit, renovate them so that they could open back up. So if we were to experience the kind of surge that New York City has experienced, or, certainly things are ramping up in California, but they tend to be in more densely populated areas like LA and San Francisco. They'll feel the surge before we do. But there'll probably be a statewide response too. So while we may be less impacted, there'll be pressure on us to then take some of that patient volume from those more densely populated areas to care for them here in our hospital. But that's all contingent on the availability of beds, staff, protective equipment. So, but that's part of our incident command system, is every day we're playing out those scenarios. What if this, what if, we're doing the actual modeling of taking our population and the risk factors and trying to predict if this continued to evolve, how would it evolve, and how many patients would we be looking at, what would be the demand on intensive care beds, ventilators. So we're doing that kind of predictive modeling to help build our surge planning around it.
Okay, great. So last week we limited the visitors in our hospital. So we're about a week into that decision. So how do you think our patients and families seem to be handling that new policy?
Yeah, it's kind of mixed, no doubt about it. I think when it first rolled out, it was rather sudden. Again, because this virus is evolving so rapidly, and we're literally making new decisions every day, again, in the interest of protecting our patients, our visitors, our staff, our community. Over those first few days, it was a little bit challenging. Folks were really upset, particularly if they had a loved one that was in the hospital that was in critical condition or was about to pass away. Under normal circumstances, we invite the whole family to be around their loved one, to be there holding their hand, and to be there together as a family. And so that was probably the biggest, difficulty in the whole thing. I actually talked directly to a daughter whose father was upstairs and had her children with her, and which would be his grandchildren, and very upset that we wouldn't let them go up and see their grandfather. So that was really, really difficult. I've personally, been in their situation, and I can't imagine what I would be, feeling at the time. Now we have created this new technology base where we can create FaceTime opportunities. So we provide the families with the devices if they don't. But this particular family I spoke to, they used their iPhones, and the daughter went upstairs and FaceTime back and forth with the kids. And so that, obviously it's not the same, but it brought some, peace to the family. But I think, again, maybe this is the upside of watching the news. I think as Tulare County residents do see what's happening across the country, they see how quickly it can intensify, and they see what most every other hospital in the country has done. They've been more accepting of it. So I really, again, want to thank the community for supporting in this. Again, it was probably one of the most difficult decisions that we've made, and there are exceptions, believe me. And so if you have a loved one that is dying, you have somebody that's going in for a major surgery, open heart surgery, brain surgery, cancer surgery, a child, that needs a parent there, a baby's being delivered, and you want dad to be there, or the mom's significant other to be there during the birth. We allow that. Patients that have dementia or other developmental disabilities, we absolutely support that, but it's, again, very limited.
Okay.